Hey, it's Adam Sewell, MD, and welcome to Module 7, Section 7.1 of the Microplastics Toxicity Training, certified by the Microplastics Health Alliance. In this section, we're starting with what I consider to be the most important phase of treatment, reducing exposure. Everything that follows in your detox plan, whether it's liver support, sauna, binders, or hormone balancing, can only work if the patient is no longer actively being exposed. This is foundational. You wouldn't drain a flooded basement with the faucet still running, and you can't detox a patient who's still drinking 3 bottles of water a day from polyethylene terephthalate containers and microwaving food in plastic. Part 1. Why source removal comes first. Let's begin with why this matters from a clinical standpoint. According to a landmark dietary intervention study by Rudel et al., published in Environmental Health Perspectives in 2011, participants who removed food packaged in plastic saw their urinary BPA levels drop by 66% in just 3 days. Another 2018 study by Szymanski et al., published in Water Research, found that even high-end bottled water brands contained microplastic particles, most often polypropylene, polyethylene, and PET. These particles originated not just from the bottles, but from the caps, the bottling equipment, and the shipping conditions. Now consider that the average adult drinks between 2 and 3 liters of water per day. If that water comes from plastic, you've got a daily infusion of particles and plasticizers directly into the gut. So when your patient presents with fatigue, estrogen dominance, low testosterone, or neuroinflammation, and they're still eating out of plastic containers, drinking bottled water, and using commercial cosmetics, the detox hasn't started. The toxic input has just become normalized. Part 2. Major sources to target in first 2 weeks. In my clinical protocol, I focus on removing the top 5 sources of microplastic exposure in the first 2 weeks. These are easy for patients to identify, require no lab testing, and result in fast wins. 1. Bottled water. Replace with filtered tap water from reverse osmosis or carbon block filtration. Store in stainless steel or glass. Educate that even BPA-free plastics often contain BPS, which is just as endocrine disrupting. 2. Microwavable plastic containers. Replace with Pyrex, borosilicate glass, or ceramic. Discourage reheating leftovers in takeout containers. 3. Food packaging and plastic wrap. Avoid clamshell containers, vacuum-sealed deli meats, and frozen meals in plastic trays. Avoid plastic wrap directly contacting hot foods or oils. 4. Canned goods. Recommend BPA-free cans only, if unavoidable. Avoid acidic foods in cans like tomatoes and citrus, which leach more plasticizers. 5. Commercial cosmetics and fragrance products. Replace with phthalate-free, paraben-free products. Avoid anything labeled fragrance, perfume, or long-lasting without ingredient transparency. Part 3. Patient Education Strategy. The 5 Ps Framework. To help patients remember this, I teach the 5 Ps, a tool developed by the Microplastics Health Alliance for counseling. Plastic use, food storage and cooking habits. Packaging, processed, shelf-stable, or microwavable food. Personal care, soaps, deodorants, lotions, hair products. Potables, drinking water, beverage containers. Profession, occupational exposure, for example, healthcare, manufacturing, cleaning. This tool helps clinicians organize their intake process and gives the patient a checklist of where to start. Part 4. Clinical example. Urinary BPA reduction with behavioral change. Let me give you a clinical example. A 34-year-old female presents with fatigue, weight gain, and hormonal acne. Her urinary BPA is 5.1 micrograms per gram creatinine. Her MTI score is 28. We delay all binders and detox supplements and instead focus only on source reduction. No bottled water, no microwavable plastics, no canned food, and we switch her to a clean skincare line. 3 weeks later, her repeat urinary BPA drops to 2.3 micrograms per gram creatinine. That's over a 50% reduction, and we've done 0 supplementation. Her skin improves, her mood stabilizes, and she reports more energy. That's the power of exposure removal, and we see it again and again. Part 5. Why clinicians need to lead this conversation. Most patients think detox means taking a bunch of supplements. They rarely consider that what they're doing daily, what they're touching, drinking, or storing their leftovers in, is the root of the issue. This is where you, as a physician, make the difference. When you identify the sources, explain the mechanisms, and give a structured plan to reduce exposure, you're not just cleaning up their environment, you're validating their symptoms and empowering their biology to begin healing. You're also building clinical credibility. You're anchoring your plan in evidence, and you're setting the stage for any detox protocols you initiate in Module 7, Sections 2 through 6. To summarize, before you detox, you de-expose. The first 2 weeks of any microplastics treatment plan should focus on eliminating bottled water, microwavable plastics, high-exposure foods, and toxic personal care products. Use the 5 Ps framework to guide the conversation. Track urinary plasticizer levels if available. And always remind the patient this is the most powerful part of their protocol. In the next section, we'll move into mobilization and binding, how to help the body clear the plasticizer burden safely and efficiently once exposure has stopped. I'll see you in section 7.2.